Namaskar.
Namaskar ji.
Swagatam. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH SAMRIDDHI and today our milestone is 2466. Thank you. Thank you for your overwhelming support, guidance, mentorship, and active participation, due to which this journey of knowledge, journey of experience, and expertise is continued to the infinite. Thank you again very much. I would like to welcome Ayurved Ratna, Shri Ayur Dr. Avtar Singh sir, renowned herbal medicinal practitioner, founder, Siddha Ayurvedic Clinic, Academy and Research Center in London, UK. Thank you. Welcome sir. स्वागतम. आपका बहुत बहुत स्वागत है. मैं आपका बहुत आभार व्यक्त करता हूं और साथ ही साथ हमारे आधार स्तंभ श्री डॉक्टर जगदीश्वर सर का नमन करता हूं. जगदीश्वर सर प्रणाम. एंड वी हैव डॉक्टर के ईश्वर राव. वेलकम डॉक्टर ईश्वर राव on the platform. Today's topic is very warning. In India, near about 7,000 cases are diagnosed with corona. Again, new variant, grandson of previous corona. So again we are in fear. Again we are afraid. Definitely we have acquired immunity due to vaccine, due to previous infection, treatment, so many factors. But then also, if cases are increasing in India and other countries, definitely it is the warning signal for whole society what we have faced 5 years before. So no one want to face those consequences before going to last funeral packed in plastic. That was a great hurting scenes at that time. No family member was supporting at that time. Nobody was there. Complete isolation, complete lockdown. What we have not seen. This was not expected in our life, but that is also an experience, bitter experience, no doubt. But we have overcome. And we are alive today. After that corona also, 3 phases also, we are alive. So on corona, to have guidance, I would like to invite Dr. Avtar Singh sir for his valuable guidance. Adani Avtar sir.
Thank you very much, Pavanji. This corona, actually, so many cases in the UK also coming nowadays. Not the aggressive like it start again, but many people, because I treated that time so many cases, those people was my patient, they came back to me. When they checked that one, openly no one saying corona is still here. Now is openly they admit corona is spreading again. There's so many vaccines. Everybody allopathy try so many vaccines. Ayurveda try. They're doing their best, I can say. Doesn't matter what people saying, but they're doing. We can't go so much detail in that one. What's happening? It's people choice what they want. When corona came in 2020, my Paramita, well-known Dr. Joshi, they living here, we working so many years together. They respect me a lot. These kind of things were, so they asked me that time, not only asked, they done my interview. I said, they asked, what is this one? I said, this is the call in Ayurveda. What, in my knowledge, what I'm saying, maybe there's so many other very, very experienced and very, very well-known, very, very educated Ayurveda practitioners, Vaidyas. They also know this one. This is not the first time came in like this one. They usually come after sometime 50 years, 40 years. But this time they're coming after less than 5 years. Why? This is the biggest problem. That time, Dr. Joshi done my interview. We have the videos. In I think May or June. I think May, April, May. When nearly 10 people I done the treatment. Some Dr. Joshi's patient, some my patient. When they came that one, they asked me, "What is this?" I say, as my experience, it's not much for the immune system problem. Not only immune system is the culprit or reason for that one low immunity. Definitely the effect to the people have the autoimmune diseases, a low immunity effect. But you can't build immune system within weeks, within few things. I don't think so. In my experience, I never seen anybody give the injection or vaccine or anything you can build your immunity. No one have the medications. With the Ayurveda procedure, Ayurveda protocol, you can build the immune system very quickly. Because I worked so many years, when I go to the search for the cancers and other chronic disease, I find out immune system is very important. Not only immune system, with the immune system, when immune system go wrong, there's other system in our body that's also go wrong. And nowadays, in my so many video, I said at the moment, 60 to 70% of the populations have the immune system problem. That is the reason Corona come back again. So many, everybody done what they can do at that time where they are best. We don't have to go which one is work, which one is not work. Now we should have to worry if they come back again, what we have to do it now. If I say so many things, maybe many people who know me, many doctors know me, that time when I said this one and prove it that one, I even offer that my treatment, my research for the immune system, my medication to India government. Dr. Joshi sent the written letter to them. No very good response. That time everybody was confused, I understand. After that one, I don't think so people or authorities taken very seriously, maybe come back or not. But they should know that time the 4 type of the different kind of variant came. They should keep in mind, maybe they come back another variant. I have as I told you, many recording. But people don't notice that one. And no one, even in the UK, I openly say today, support me very nicely. Most of, we had the association that time, they made the very big group, that one, well-known doctors inside. They all said, what are you using? Give us the formulation. There's some people from the India, they say we are in the Ayush Ministry, send the formulation to me, we can forward your formulation to Ayush Ministry. I say, in my video, this is proof. I not demand anything about my research, but only one demand: how I made this medication should be start under my supervision. And I don't demand anything from the government, from anybody. Even I offer this one to British government here. Some of the doctors say after when I not disclose my treatment, they start big arguing with me. We need now, Pavanji, is very, very important now in the world. As I told the 5 years ago, 4.5 years ago, our everybody, even so many people, their immune system is very bad conditions now. Most of people living on the medication, mineral, unnecessary they're taking the minerals. No need those minerals. But no one listening. And they think take the minerals, vitamins. No, that is not the treatment. Your body should work, your system should work properly. You don't need any mineral. Okay, in the old age, you need something, but not all the time. Now situation is the COVID, officially, they admit COVID came back. What kind of precaution we have to take? It same like last time. Everybody, doesn't matter who made that one. They are not very successful that time. COVID, still people die, millions people die in all over the world. Everybody saying, oh, my formulation is better, my this is better. This is not. I tell the people after that one, they not took the lesson. They not, that time I say again today, please, for God's sake, look after your immune system. Look after your health. If you have any health issue, do the treatment. If your system is not responding to you, find out somebody in your area and look after, and stop eating rubbish food. Stop eating outside too much. Why our system is go wrong? Why our body not start repairing self, our organs? Because we giving them wrong food. Our fuel is our food only. Good water, good food, good air. 3 things our body need. And good rest. These 4 things we not giving what our body required. First, to start taking these precautions, eat good food, drink plenty of water. Try to, if you can't find the good water, put some herbs inside, make the alkaline that water. If you can't find anything else, put the 2-3 things. Basil leaf, fennel, little bit ginger, little bit. No need too much strong. And make that every morning, boil it, put it inside, 2-3 minutes, boil it, make the 2-liter bottle with you and drink that water all day. Don't drink water from outside. Doesn't matter any water available. You make 1 boil or 2 boil, put these things, keep all the time with you. Don't take from any water from any bottles from outside, and stop eating street foods. Cook at home. Eat simple food. Give your system to support, they can repair themselves. When you do this one, if you have any health issues, contact your nearest doctor, which one you believe them. These are the most important to save yourself from the COVID. But if, as I sent the one's question as symptom form, last time I made it when the 2020, this one came. But that time we can't see face to face any patient, then I designed this one. And people send it to me, and then we send the medication to them. You don't need to see the patient. There's one other questionnaire I can send you later on. This one you can put a post in the group. If we have to be don't be neglect what they're saying. Don't be ignore the government's policy, what they're saying. They're doing their best, what they're in their knowledge. We have to follow that one. Stay little bit away from each other when you talk 3-4 feet away. If you think that area Kamram is gone too much, then use the mask, that one. Don't drink each other glass, same glass. Don't share your food when you're eating with somebody else, okay? Don't even share your clothes. But nowadays, too much hot weather. When they're sweating, through the sweating, this one can go the virus, this one inside. These kind of precaution, if you take it, if your digestion is not good, take some precautions. There are so many things nowadays in the Ayurveda that you can find out that one. If you have the big problem, as I say, you can go to find out any Ayurveda, homeopathy, allopathy, what you believe.
This is your questionnaire, sir, what you were giving to patients.
Yeah, this is my question. This is actually symptom form. People tick on that one. As I said, if you have the 3 symptoms, definitely 99% you had the COVID. And check it immediately. When you check it, when you find these kind of symptoms, doesn't matter, there's 19 different kind of systems. Last time we have the experience, this one I made last time, no need to change that one. That time also same time. So we have the different kind of medication. If somebody have the diarrhea with that one, some people have the pitta vardhak, some people have the other type of that one. There's a Vata Pitta Kapha is everywhere going on. Different kind of nature of the body, different kind of symptoms come. Some have the fever, some have the nose problem, some have the appetite problem. So you can't give the same medication, but what are 3 things told, you can use everywhere, okay? If you have too much, somebody have the urine problem, you can put some other things inside. You can ask the local, there are so many things inside, okay? You drink the coconut water, don't drink too much cold water. Keep your body's temperature on the 36 and a half. Don't let that down, don't get the high. If you think your body is start feeling tired or anything, like symptom which one we have, I mentioned that one. And that one you can, straightway you can take some medications. But I recommend, there's so many, I can tell the many name, but better on that state, don't take risk. Everybody seen. Last time also people everybody taking kadas or anything, this thing, that thing, the kadas not work properly. Better you find the professional and tell them, maybe government, if they want, government still, what I done last time, I can't disclose everything, my formulations, but I can tell which one you can protect that one, or the government policy, government's rules, what they're saying, so this one. You can, they can follow that one. And Ayurveda doctors know now, they had the experience from the last time. I'm sure they are definitely more experienced now to how to handle these things. Or sometimes same medication, we can't give the pitta vardhak, we can't give the same thing, this one. Keep your immune system, keep your bowel movement properly, okay? If they have, the people have the constipation and digestion problem, the people as reflect that when people have the lot of bloating inside, they need the treatment. Don't ignore that one. Go and find and need your doctor. Ayurveda doctor, they are all suction to do it, that one. So if they don't, if they ignore, doesn't matter, not came yet in our area. This one last time we have the experience. They take days, spread to other area. One person can give hundreds of people this one. So don't be neglected this warning. Government doing that one, and I'm sure Ayush Ministry definitely doing on that one something to save our people, and they are doing their best. Okay, and we can only tell the people, if they have anything, find this symptom form, if spread everywhere, and they can very quickly diagnose themselves, little bit alert, then they can straight away with this. I'm sure the same, the testing kit with which one they doing the test for the COVID available everywhere. They can check at home. If they find, go to quarantine, stay away from other people, and tell other people, I got the COVID, stay away from me. Many people they hide. Should not be do it like this one. I seen here in the UK that time many people they don't told anybody. I don't know why they shy that one. I don't know what kind of mental state that one. If you have something, that tell other people. If they do that one, we can handle this time better, because a lot of experience last time. People are, Prabhu Kripa Kare, this should not be happen like before. That time is very painful when we remember that time. So many people died that time, unnecessary. And some, I say, that time I said, I'd say again same word. This is lungs, nose, and throat problem. Protect these things. If you don't protect these things, become the problem. That is, they say use the mask. I say use the mask, no problem, but not all the time. Use the mask. Because when we use the mask, that one, our carbon dioxide come out and go back again inside. I design here, I don't have with me, to that mask, I cut it and make the little hole this side, at least air going out. I can show you that mask, which one I designed. I still keeping in my, if I go in the public area, and I can show you and put it on my mouth, and people can do it, that one. Look, this is my mask. Look, you see? And also I put the two hole this side. One this side, one this side. Look, small hole. And all the carbon dioxide at least not going back in our lungs. This is the, so also, if you make the mask, they make the mask in the billion mask they make on this. They not put the, you should cut it a little bit, and at least what is the carbon dioxide coming from your, everybody know when our breath coming out, the carbon dioxide throwing the lungs. If they're going back inside, that's the more dangerous. But this mask you can use a whole day. Make some side. From side can't go inside to your mouth. That means little air is crossing from there. Is less carbon dioxide go in your body back. Okay, that is the more dangerous. That is the so many people suffer more. So if you do that one like a precaution and stay away a little bit, go to the countryside area, walk in the garden, breathe under the tree. We're not doing that one. We're living in the all the time in the air conditions. Less air condition, use it. These kind of, if they use your health, lungs stay healthy. And one exercise, I use, so many people have the lungs problem. That's very helpful. On my website, you can find out that one. And that one is I designed because some of my patients have their lungs was collapse in the body and scar on the lungs. They can't breathe properly. Then I can little I give them the lesson, and it's like a Kapalbhati, very small Kapalbhati, very light one. And you just throwing the air, make the lungs pockets clean. I can show you a little bit if you allow me.
Sure, sir.
Okay, just sit down. Fully, your spine should be straight. Close your mouth. You just throw once you take the breath inside, don't take back breath again. And you start throwing through the nose out. Kapalbhati have the different little bit, but this one is no need to very strong, very light. I show you like this one. I close my mouth now, then I'm starting. Thank you very much. This one,
Bhastrika, sir. This is called Bhastrika.
Bhastrika, but in Bhastrika, we can take the breath inside if you feel, but this one continuously close your breath, okay, and just throw through the nose because lungs pocket become clean. When it's like throwing out, not taking anything inside. Then you stop. When your breath is say, I can't take it more, don't do the by force. My patients start from 10, 15 to they go 70, 80. So this one, you can do anywhere. You are working, you are walking, you can do it, that one. This is, I have experience. The people who have the lung cancer, who have the lungs problems, that I gave them, and they work very well. They help the exercise like lungs, like a lung scar. People have 2 patients. They have the lungs fissure on lung scar on that one. Lungs was collapse on that one. They 100% from the hospital. They discharge from them. They say you don't have your lungs is normal position now. All the moisture go from the lungs with this one. When we throwing our breath out, any extra moisture, which one lungs giving problem, they go out. And oxygen get more better after half minute, 1 minute, depend on I never notice how long I can handle. I go up to 70, 80, 90 up to in one breath. And I do every day 2, 3 times. When I remember, when I need, do it. But do it this position. If you are driving, you can do it. If you are walking, you can do it. Keep your spine straight. Because that nervous system then cover your whole body. And spine also become on the level. Spine should be, all the vertebrae should be on their position. So this is very helpful. This also reduce the cough, reduce the carbon dioxide from the body, and the more oxygen inside, more your immune system work. It's also help to the stomach, gut bacteria, so they can shaking on that area, but not very hardly. When they have some people have the problem, they can't take very big Pasca or Kapalbhati. They can't take very strong. But this is very light and very helpful. This is, I recommend all my patients, do it. When you have the time, do it. So, and like I told you, this one, make the alkaline water. You can make the tea on that one, or you can make one, doesn't matter cold, doesn't matter hot. Don't drink the water in the bottles and anything, and just boil once at least, okay? And after that one, you can put a little salt inside, pink salt. You can, if you like the black sea salt, you can put that, okay? That salt is black salt, this salt, which one you want? If you want, you can put it inside hinguistic churn, half, okay? They make like a 2 liter water, put the half teaspoon inside. They can go in your whole body, then they make you the digestion system better. We no need very big medication in our internal system. We need the simple thing to do that. The body can do their work, their own, our organ. But we need what we drinking, what we eating. As I say, that is our body's fuel. We eating very heavy food. Stop heavy food eating. Stop unnecessary silly oils. Okay, this one good. I use only pure ghee and olive oil. That's my every day. I eat at least 50 gram ghee. I eat every day, and give your body's nutritious food. Okay, enough mineral nutrition in the ghee. If you can't digest anything, don't eat it again, especially in this time. If you don't think milk is very good, but if you find the milk, pure milk, where's the pure milk now? Better you don't drink that one. At least you know drink that silly that thing. Now there's so many artificial milk, artificial ghee. No, if you want you can't find the ghee, then buy the cold press mustard oil, cold press coconut oil. That is best both. And very cheap nowadays in the I bring from India. They only cost me I think 5,000 rupees or 10,000 rupees. That small machine, you can enough for your family that make the oil. You know, at least you mustard you bought the pure mustard. You know, you pure the seed you bought. So start living a healthy living. Otherwise, this kind of the problems coming and again and again. Now we never expected after so many vaccines this happen can start again. This was not gone. COVID never gone. They have the people on the people. I don't know other country or not, but a lot of side effects from that one they left inside. They damage a lot of our nervous system. Many people have the lot of clots. Many people, the brain is not sleeping properly. They have the confusing so much problem. So please, to save yourself, follow the Ayurveda. Ayurveda saying this one, अल्पाहार सुल्प सी निद्रा. आहार जो है आपका वो अल्प कर दो. Eat very food only 70%. Keep your stomach 30% empty. Sleep well. Don't overtire your body. When we overtire our body, work too much, not our body allow, don't do that one. Then our system never be charged properly. If you follow the Ayurveda rules, regulations, Ayurveda system, I'm sure we can fight with this COVID again. I'm sure people don't have the problem. People learn the lesson from last time. And I say again, if you find you have the COVID, government made so many medications now. I'm hope this all work. So many Ayurveda doctors have the experience now. They know how can they handle that one. This is the most important, most today's. Thanks very much. You look after the public. This is your heart, okay? And I always pray for you. You're doing the great job. You not looking the how many webinars you've done. You do the to the point things. That is your greatness. I'm always very happy with you and what you're doing. God bless you. If any question anybody have, I'm happy to give.
I would like to remind you all and our YouTube viewers regarding government guidelines for this. Ministry of AYUSH detailed greatly. Just a second. So Government of India had
जी.
issued the guidelines, sir, in previous COVID-19,
Mm-hmm.
though it was more serious in 2020.
Mm-hmm.
Excellent guidelines, sir.
Mm-hmm.
Complete guidelines. AYUSH recommendation, general preventive guidelines. First guideline is
Mm-hmm.
general preventive guideline.
Okay.
So first general preventive measure, stay updated on the latest information from
Mm-hmm.
authentic and reliable sources. No WhatsApp University. Follow the COVID personal hygiene protocol like wearing mask, hand washing, and sanitization as you told, sir. Follow respiratory hygiene protocol, maintain physical distancing, quarantine, isolation protocol, take vaccination. This was the
Mm-hmm.
general preventive measure. Measures for promoting systemic immunity. So first of all, I use Kala or Quat.
Mm-hmm.
This was researched in 2020. Maurya and Sharma researched it. 4 parts of Tulsi, holy basil, 2 parts of cinnamon, 2 parts of Sunti, 1 part of Krishnamaric, jaggery or black raisins, Vitis vinifera, मुनक्का जिसको अपन कहते हैं
जी.
वो, and or Nibu Swaras, lemon juice.
Mm-hmm.
It may be added as per the test. So add 3 gram of ayosquat churn
Mm-hmm.
to 150 ml of boiled hot water, stir well and allow to rest for 5 minutes. So this is phant, this is not quat.
Mm-hmm.
It's generally phant, hot infusion.
Mm-hmm.
Okay, so we should not boil it more because every ingredient contains essential oils which can be destructed in boiling. Because every essential oil is generally essential oil is destructed above 60 degrees centigrade and
Yeah.
water boils on 100 degrees centigrade.
Mm-hmm.
So second one was there Kavasura Kudnir. This was also Siddha preparation. It has also been researched by Natarajan in 21. 5 gram of Kavasura Kudnir powder to be added in 240 ml of water and it will be boiled. It is not hot infusion. It is quath and boiled to reduce 60 ml. So it must be used as per our Ayurvedic principle within 3 hours of preparation. Dose 50 to 60 ml. Maybe Ayush Kala or maybe this number one. Number second. Number third, golden milk for immunity. This was also researched in Babei 2020, Sharif Wright 2020. Once it is scientifically researched. Half teaspoonful of turmeric powder in 150 ml of hot milk once or twice a day. It can be taken. It is easy and available in our kitchen also. Government has not suggested except this Kudnir, Kavsura Kudnir. All ingredients are generally available in our home garden or home kitchen. Next, Guluchi, Giloy, Tenuspora cordifolia. It was also researched in 2020 and 2021. 4 researchers are there. So, Guluchi Ghanvati, Sanshamani Vati or Giloy Ghanvati, having aqueous extract of Tenuspora cordifolia, 2 tablets twice daily after food from warm water. Next, Guluchi Phant. Take 10 pieces of Guluchi stem, 3 centimeter each, remove outer skin, crush the pieces and put these in 100 ml of boiling water. Store overnight and then drink in the morning. Minimum 1 teaspoonful honey can be added if required. So this total glass 100 ml should be drank in the morning. Ashwagandha or Amukara churn, Indian ginseng Withenia somnifera, as we are all aware. Dosage 3 to 5 grams twice a day with warm milk or water, or ashwagandha extract 500 mg twice a day with warm water. Here my Ayurveda dies, sir. Why we are unwantedly facilitating patient when our dose is not 500 mg. Previous dose is excellent, 3 to 5 grams.
Yeah.
And if we take 5 grams TDS, total dissolved solid, it will be minimum 1 gram. So half dose medicine cannot be effected as we desire. Chavanprash. It was also researched in 19, 10 gram in the morning with warm water and milk. It is also half dose of the Chavanprash because in our Ayurveda, it is written more. Actually, Chavanprash was written for Rasayan effect, and it was written in our text that if you take Chavanprash, 50 gram, 60 gram minimum, and then don't take food at that time, then it will work as a Rasayan. So now, for convenience, 10 gram is okay. Medicated water. Boil 6 to 7 tulsi leaf with 1 liter of water for 10 minutes. Everything is gone, in my opinion. Then take, it should be there. Dip your basil leaves in hot water, boiled water, and keep it closed. Then it will be more effective, in my opinion. Then measures for promoting local mucosal immunity. Nasal application, Pratimars Nasya. Haridas, it has also been researched in 021. Apply 2 drops of til tel, either nariyal tel or cow's ghee or anu tel. All 3 items, til tel, nariyal tel, cow's ghee, available in our home kitchen. So anybody can practice it easily. Otherwise, if serious and chronic problem is there, please put anu tel in both the nostrils daily, morning and evening. Steam inhalation. It is also research. Means whatever they have given with reference of researches. So steam inhalation, boiled water में डाल के पुदीना, मेंथा स्पाइसेटा, तुलसी, होली बेसल, ओचिमम, निर्गुंडी, वाइटेक्स निगुंडो, Ajmoda seeds, Tracheospomum ammi. So this is the steam inhalation. It can be done by cooker also. Otherwise, portable steamers are also available in 100 or 200 rupees. Jalneti, nasal wash. This is for local mucosal immunity. Jalneti, it is the process everybody knows. We have to take water from one nostril and out from second nostril. So this is also very good for washing the local mucosa. So it will not be, infection will not be able to stand sanchray on that particular part. Oil pulling therapy. Kaval. Kaval was, Sarad and Kapoor has researched it at 2021. Take 2 teaspoonful, 25 to 30 ml warm sesame oil, til tel, or coconut oil in the mouth. Swish in the mouth for 2 or 3 minutes. Like this, roll it out and spit out. This can be done once or twice a day, preferably in the morning or at bedtime. Mouthwash. Kaval, that was Kaval and it is Gandus. Take 1 teaspoonful powder of roasted ajmoda, ajwain, Tracheospomum ammi, in 500 ml of water and boil it until it reduces to 250 ml, means half quantity. Use it, that decoction, for gargling. Gargling with 250 ml of warm water with haridra powder, turmeric powder and a pinch of salt we are generally doing when our throat is sore, means that is not in good condition, we are generally practicing it. So government has supported our practices. Relief from dry cough and sore throat, stimulation, lavang powder mixed with natural sugar honey can be taken. Everything, sir, everything government has suggested excellent guidelines for, because at that time no medical store was open generally, no online and no Swiggy and Zomato was there. So this is the great medicine will come in the next session. Fumigation of surrounding, dhupan, neem leaf, loban, kapoor and ghee. So generally take it in fumigating vessel, put it on fired coal and fumigate your whole infrastructure, your clinic, your home, anything. So entry of this COVID spike, it possesses a spike S glycoprotein. Definitely it is B.1.1.525 new variant also having these spikes. So, which binds to the cell membrane protein ACE2 to enter human cell. Nasal and oral routes, gateways for the virus to enter the cells. These are the gateway, as we are all aware. SARS-CoV-2 targeting lungs, making deeper inroads. So, lungs immunity is very much important. AYUSH practices and local mucosal immune response. Generally, Ayurvedic blocking how Ayurveda works there, blocking the gateways of entry of virus, nasal and oral, could be a good choice to reduce, even prevent the transmission of virus. Nasya, this is also prevention of virus because we are working on gateways. Steam inhalation, this is also gateway. Jalneti, we are cleaning the gateway so infection cannot go deeper. Oil peeling, mouthwash and gargle. So all these recommendations are generally available in the house and nobody has to go to chemist or medical store. Generally, dietary recommendation they have given. Advice to refer annexure 1 also. Intake of food in time only, on feeling of hunger and after digestion of previous meal, as you told. Kale bhojan. Maintain proper hygiene at culinary place, suchi bhojan, shuddha bhojan. Intake of food which is warm, ushna bhojan. Intake of food which is easy to digest, lagu bhojan. Eat while there is interest to food, and while eating concentrate on food, tanmana bhunjit, tanmana bhojan. Don't see TV and mobile at the time of that, and don't talk too much at the time of taking food. These are our Ayurvedic principles, what government has communicated to every household. Eat food with 6 text component. Madhuram, Lavan, Katu, Tikta, Kasai, all rest should have. Food should be ingested calmly, neither too slow nor too fast. No ati drut vilambit, neither drut nor vilambit. No fast, no slow. Food should be taken after bathing and after attending the natural calls, not before that. You are taking food and then bathing. You are having the pressure and then also you are eating. Both are wrong. Food should be taken food for good digestion. Imagine 3 parts of stomach, as we tell everybody. Our stomach is one Anjali. Every human being has its own Anjali. So our stomach has capacity of one Anjali. Make 1/3 part to solid, make 1/3 part to liquid, and leave 1/3 part for air. This is the Ayurvedic principle. So government has communicated this also. Eat what grandmother used to eat, and eat from 100 kilometer of radius. 2 things. Very nicely said. Eat what your grandmother used to eat, because there was no Swiggy, no Zomato, no generally trade so much. So everybody was limited to eat the items which are being cultivated, produced or generated within 100 kilometers of radius. So this यस्मिन देशे तद देशे वो उसी देश की औषधि उस आदमी को अच्छी रहती है या सब्जी अच्छी रहती है। आज की डेट में तो हम पुणे का अल्फांसो कलकत्ता में खाते हैं और मतलब सभी चीजें अवेलेबल है। Practice region specific traditional food processing techniques means region specific traditional food processes are better than these continental processing. So use those practices. What was your grandmother doing in your kitchen at that time? Must not sleep immediately after consuming food. This also I communicate to my patients. There should be a gap of minimum 2 hours. So our food will leave the stomach and enter into the duodenum and our intestine where peristalsis movement is there. In stomach, no movement. So this will be unwantedly creating problem in acid tank if you lie down. If you are walking after food, after dinner or after food, this will go to the intestine by gravity also, by movement also. So you will feel better. Restrict, as you told, sir, restrict use of food items, they are heavy to digest. Guru Bhojan, no Guru Bhojan. Watching TV, use of phone and other similar activity during eating are not advised. Same line was written before, like Tanmana Bhojan. So use natural sugars like honey and jaggery without chemicals and reduce the intake of refined sugars. Fried, refrigerated, rewarmed foods have a bad effect on the digestive fire, Agni, and should be avoided or considerably minimized. So healthy diet, water, drink water preferably as per body need, normal room temperature or water stored in glow point, not refrigerated. As you told, no refrigeration is advised in fever, corona or rhinitis, normal rhinitis also, if corona is not there. Use copper utensil to storage of drinking water if possible. Avoid drinking too much water immediately before or after meal. It will dilute our hydrochloric acid gastric juice and it will create Agnimand and food will not be digested. Oil for cooking, every aspect government has communicated, sir. It is
Very good.
unfortunate that it has not been communicated to each and every household. Everybody is not acquainted with the internet and downloading, etc. So these guidelines should move to every household of world. Please then check the result. No corona will be there in the world. Oil for cooking. Oil सरसों तेल generally, तिल तेल, नारियल तेल, मूंगफली तेल, राइस ब्रान तेल और वर्जिन कोकोनट ऑयल, ये चीजें आप उसमें ऑयल फॉर कुकिंग में करें. इंक्लूड स्पाइसेस इन डेली डाइट. जीरा, दालचीनी, सौंठ, अदरक, जिंजर, गार्लिक, कार्डमम, मस्टर्ड, कैरम सीड, अजवाइन, टर्मरिक, ब्लैक पेपर, कोरिएंडर. So small, use in small quantity. These are also means appetizer, carminative and immunity booster. It has been proved in last corona. Spices are a stimulator and enhancer of digestive fire and boost natural immunity. Fruits. Eat seasonal fruits. Fruits shall be used in moderation but with care. They should be eaten with properly ripened, no carbide ripened. Orange and pomegranate are good option. Amla, amalki is a source of vitamin C, so best for immunity. Dates have good health effects, good benefits. So they have shown in visual graphics also, sir, healthy diet, unhealthy diet. Good and strong digestive fire system, poor and weak. So they have tried to communicate well as per the government section. So then these are general, then specific system-wise guidelines are there. It will take time, so I am not repeating that. But these guidelines are based on respiratory system, different guideline, mental health, different guideline, set of guideline Government of India, Ayush Ministry has given us, sir. But it is the need of the hour at this time. What I want to say in conclusion, these guidelines should reach to every household. We should circulate this PDF to every household that no corona can enter in any house. Avtar sir. Please unmute. You are mute. Sound.
All
Yes.
the guidelines you explained, that's very, very well. And so the simply, as I say, many people, if they, what the symptom question, symptom form I made, if everybody keep in their home, they can protect themselves in the immediately. And also, so many things government said, if they follow that one, definitely we can save our people, we can save our life. We don't have to suffer like they suffered before. So I say to this one, it's a very nice, very nicely government done good job now this time, but they have the experience before, and you explained very well. So this one, hope this one is work. People listen this time. That's most important. So people listen this year
Previously,
and
sir, it
go
was
for this
late.
year.
Previously, it was published in third phase of the corona.
Okay,
Now,
okay.
now we have suitable time to
Yes.
circulate it for
But
every person.
you circulating, government circulating. That time I told you this one is people listen. That's most important. People complain when the problem come on their head, but not taking precaution before. They want to dig the well when they are thirsty. They don't want. They know water is most important for the life. If you don't have the food, you can live on the water. But how many people they saving the water? How many people they making the good water? They are people are they think biggest problem in our people. They think I am okay. Those are problem have the problem. This is the biggest problem. Oh, we are okay. They got this one. They don't know we are living in the same world, same air, same food, same everything. You can't run away from the problems. All together, if we work together, take the precaution, take everything, we can fight with the corona. Is just one thing. It's not like a we survived from last time. Okay, last time is a lot of damage. If we work all together, as you say, and government is trying, all we are trying. Why we doing this program? We're doing to save the people. We know we following that one.
Very
I am
right, sir.
very strict on my diet. Many people say, no, my time is not here. I tell you, my father was so strict. He eat 2 times only. Morning 10 o'clock, evening 6 o'clock. Sometime our sister's husband come, they purposely say, Dad, can we do the lunch with me? He said, oh, I can do the lunch. I love to lunch. But if you want lunch with me, come tomorrow 9:30 here. Doesn't matter. दामाद की हम कितनी इज्जत करते हैं, वो कहते थे, if you want lunch with me, come tomorrow 9:30. Then we do together. So we have to follow the rules. Doesn't matter somebody following and not following. Everybody individually, we have to follow the rule, follow the precautions. Then we definitely can fight with the corona again. Doesn't matter they came, we can't stop them, but we can fight them. Be a good fighter. So sabhi ko bahut bahut pyar. Okay. Hope people listen government's instructions. We say I try, you try your best. Why we doing